Okay, we're gonna go over cervical spine. The routine views for C-spine are gonna be lateral, RPO, LPO, AP, and odontoid. We will be doing them upright. For dressing instructions for this, you'll have your patient take everything from the waist up off. Usually we do that to ensure that there is no bra straps or shirt collars or buttons or anything that are in the way. Glasses need to come off. If they have any removable dental work, also hair ties, things like that, that would be in the image. For history, you want to ask the patient if they had an injury. If so, what happened, if they get pain or numbness down either arm, if they've had any previous surgeries, or any limited range of motion. So I want to make sure first that my tube is in transverse detent. I'm going to click my upright bucky and I'm going to go into a 72-inch SID. The lateral and the obliques are done with a 72-inch SID, so I'm going to start with my lateral. I'm going to have my patient turn and put their left side up against that board so that they're facing the wall. I want to collimate down to a 10 by 12. And I'm going to center at about the level of C4, or the upper thyroid cartilage. I want to make sure that I have 1 inch of light above the EAM, and I have light down into the shoulder. This board's going to move up beside you. I'm going to put my left marker on the anterior side of the patient. I want to make sure that the patient is nice and straight, there's no rotation. I'm centered right along the spine. You want to drop the shoulders forward and down, there you go. And then my breathing instructions for my patient would be taking a nice big deep breath, blow it out, and relax those shoulders down as much as you can. I would also shield my patient with a lap shield between the tube and the patient. After my lateral, I would tell my patient to breathe, but try not to move. I'm going to immediately come over here, lower my tube down, and I'm going to angle up 15 degrees cephalad for my posterior obliques. My posterior obliques are going to be a 45-degree rotation. I'm going to roll you back towards this board here into about 45 degrees. I'm going to have you kind of turn your head towards that board there. So it's going to move behind you a little bit. I want to make sure that I'm centered on the spine still. I'm going to lower this down just a little bit. I want to be at the level of C4. Just going to move one more time behind you. Again, I still want to make sure that I have a little bit of light above my EAM. I would have my patient hold nice and still like that and suspend respiration. I'm going to leave my tube just like it is, and I'm going to turn my patient towards the right side. I'm going to angle him 45 degrees. Go ahead and look off the distance there. I'm going to make sure that I'm again centered at the spine. For this one, when my patient is in an RPO position, I am going to use my right marker on the right side there. Have my patient hold their breath just like that and not move. Now I'm going to go right into the AP because just like the obliques, the AP has a 15-degree cephalad angle. So go ahead and turn and put your back up against that board. I'm going to bring my tube in to a 40-inch SID. I'm going to change my collimation to 8 by 10 lengthwise. Again, I'm going to center at the level of C4. Bring this board up. I'm going to make sure that my marker's in the light. I want to be centered at the mid-sagittal plane, and I want to make sure that the chin and the base of the skull are on the same plane to get best visualization of C3 through T1. Bring your chin up for me just a little bit. Good. And then again, I'm going to have you hold your breath and don't swallow. After the AP, I'm going to do the Odontoid View, which I take my angle off, collimate down immediately so that I don't put light in my patient's eyes. I am going to have you remove your mask for this one. So what I want to do is make sure that the upper teeth and the base of the skull are on the same plane. I'm going to feel in the back of your head. And then what I want you to do is, actually you're lined up pretty good right like there. Open your mouth for me as wide as you can. Bring your chin down just a hair. Good, right there. And then I'm gonna center right in the middle of the open mouth. I'm gonna push on you just a tiny bit. And again, hold your breath, don't breathe, don't move. You can go ahead and close your mouth. I do have them take out any removable dental work for this and make sure they're not chewing any gum. Gum can show motion on the image if they chew it, and it can also show up as a density on the X-ray itself. And that's it for C-spine.